Do you often feel like a thought is stuck in your mind, and no matter how hard you try, you can't stop it? Or do you find yourself repeatedly checking things, such as repetitively checking the door, washing your hands frequently, or cleaning even when there's no visible dirt? These may not just be ordinary habits, but could be a sign of obsessive-compulsive disorder. OCD is a disorder that can take control of your thoughts and behaviors, significantly impacting your quality of life. Hello everyone, I'm Dr. Syeda Quadri, a U.S. board-certified psychiatrist. I've been working in the mental health field for the past 15 years. In today's video, I will talk about obsessive-compulsive disorder and its common causes and symptoms. Please pay close attention because this condition is often overlooked. Obsessive-compulsive disorder, commonly known as OCD, is a mental health condition where you experience recurring unwanted thoughts or fears that cause anxiety and discomfort. This is the obsessive component. To manage these thoughts, you engage in repetitive behaviors called compulsions. For example, repeatedly washing hands, checking things over and over, or arranging items in a specific order. These behaviors might provide temporary relief, but the cycle repeats itself, increasing distress and significantly affecting daily life. OCD affects about 1% of the global population, which translates to nearly 70 million people worldwide. In the United States alone, it's estimated that over 3 million adults experience OCD at some point in their lives. OCD affects both males and females globally, but females are at a slightly higher risk, especially during adolescence. In males, OCD often appears during childhood or early adolescence. According to studies, women are 1.5 times more likely to develop OCD compared to men. I hope this gives you a clearer understanding of how many people are affected by OCD. Now let's explore how OCD impacts the brain and which parts are most affected. Obsessive-compulsive disorder not only impacts your thoughts and behaviors, but also significantly affects your brain's functioning. When you experience obsessive thoughts and compulsive behaviors, your brain gets stuck in a cycle of continuous, unwanted thoughts, triggering anxiety and distress. Research shows that specific areas of the brain exhibit overactivity in individuals with OCD. These areas include 1. Orbitofrontal cortex. This area is associated with decision-making and impulse control. In OCD, the OFC becomes overactive, leading to the development of unnecessary thoughts or fears. 2. Caudate nucleus. This part of the brain controls repetitive behaviors. In individuals with OCD, the caudate nucleus doesn't function properly, causing compulsive behaviors to repeat in a loop. 3. Anterior cingulate cortex. This area helps with conflict resolution and error detection. In cases of OCD underactivity in the ACC, makes it difficult for individuals to stop their repetitive behaviors. These are the key areas of the brain affected by OCD. Now let's take a look at the symptoms to help you identify if you or someone you know might be experiencing this disorder. 1. Obsessive thoughts. Obsessive thoughts are recurring, distressing ideas or fears. These thoughts are uncontrollable and can cause significant distress to the individual. Fear of germs or constantly thinking that a mistake has been made. 2. Compulsive behaviors. Compulsive behaviors are repetitive, ritualistic actions performed to manage obsessive thoughts. Repeatedly washing hands, checking if the door is locked, or arranging items in perfect symmetry. 3. Physical symptoms. OCD can also affect the body. Common physical symptoms include chronic fatigue, muscle tension, and disturbed sleep patterns. 4. Emotional symptoms. OCD deeply impacts emotional health, often leading to feelings of guilt, shame, and severe anxiety. 5. Avoidance behaviors. People with OCD may try to avoid situations that trigger their obsessions. This avoidance can restrict their daily life significantly, avoiding public places to steer clear of germs. I hope you now have a clear understanding of OCD symptoms, but the biggest question is, why does it happen? What are its causes? Let's explore these one by one, starting with genetic factors. 1. Genetic factors. Genetics plays a significant role in OCD. If someone in your family has OCD, your chances of developing the condition increase. This inherited risk can also affect the severity of OCD symptoms. 2. Brain chemistry and neurotransmitter imbalance. An imbalance in neurotransmitters like serotonin in the brain contributes significantly to OCD. This imbalance impacts emotional regulation, making it challenging to control obsessive thoughts and compulsive behaviors. 3. Environmental factors. Childhood trauma, emotional neglect, or chronic stress can play a crucial role in the development of OCD. These factors weaken mental resilience, triggering OCD symptoms. 4. Traumatic events. Experiencing a traumatic event can initiate obsessive thoughts and compulsive behaviors. Past abuse or sudden life changes can exacerbate OCD symptoms. 5. Personality traits. People with perfectionist tendencies or an overly cautious nature are at a higher risk of developing OCD. Their behaviors often involve seeking repeated reassurance or control. 6. Childhood infections. In rare cases, infections like streptococcal infections during childhood can trigger OCD-like behaviors. This condition is known as pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. 7. Family environment. A strict or overly controlling family environment can increase the risk of OCD. Consistently high expectations from children can lead to the development of obsessive behaviors. 8. Cultural and social pressure. Cultural norms emphasizing cleanliness, orderliness, or perfection can heighten OCD tendencies. Societal expectations often compel individuals to perform repetitive behaviors. 9. Chronic stress and anxiety. Prolonged stress and anxiety impact brain functioning, potentially initiating or worsening OCD symptoms, leaving individuals in persistent distress. Obsessive-compulsive disorder is a condition that deeply impacts an individual's mental and physical well-being. Recognizing its signs and seeking timely help is crucial. With proper diagnosis and treatment, managing OCD is entirely possible. If you found this video informative, please like it and share it with your friends. Let us know in the comments which aspect of this topic impacted you the most. In our next video, we will discuss natural and effective treatments for OCD. Don't forget to subscribe to the channel so you don't miss it. Click on the I button above to check out our anxiety overview video as well. Stay informed, stay healthy.